gave me some cake. Back and she's like, I saved you some pizza with your name on it. At this point, the patient had been down for 30 to 40 minutes. But it's day 2 at the ER, so let's head in. Hi guys, welcome back to my channel. My name is Welcome back to my channel. My name is Maureen and thank you so much for clicking on this video. This video is going to be a vlog of my first let me get my words together. This video is going to be my first time stepping onto a unit that I actually really want to be on. So let me do a little bit of backstory. Oh my god. So for senior year, our spring semester was split into two parts. The first 6 weeks and the last 6 weeks, making a total of 12 weeks. And the first 6 weeks was lecture, clinical rotation, exams, and being on campus, doing live reviews, doing Zoom calls. And now we're in the last part, we're in the home stretch, we're in the last 6 weeks, and this is where my immersion starts. Other schools call it different things, and my school in particular calls it immersion or preceptorship. I get to be on a unit for 12 hours following a nurse's schedule and almost like role playing the part of a nurse, like actually seeing what I'm going to be doing in the hospital. Depending on where I get hired, fingers crossed, it's where I want to be. I, for example, really wanted ER, ICU, or the OR, anything that had to do with that, because my end goal is to be a flight nurse, like I've said before in my previous videos. But how it works is your school or your university will reach out to those hospitals, and the hospitals will respond back with the amount of spots, the times, the days, basically the availability. In my position, I was not guaranteed to get a spot where I wanted to work. I could have been on a med-surg unit, I could have been on something that doesn't spike my interest, but it's also very important to know that preceptorship is about learning and applying yourself, so what you put into it is what you get out of it. I would have been happy anywhere. I'm glad to have a spot in general. I am just really happy and really glad that it's in the emergency room. So that's what this video is gonna be about. My first day is on Sunday, so my hospital in particular gave us 2 days that we get to go to the hospital, which my days are Thursdays and Sundays. So I'll be going to the emergency room on those days, and it's day shift as well. That's another thing. Some students got night shift, which isn't bad. I was willing to work anything if it was in the unit that I wanted to do, but also, like I said, glad for anything. I'm here to learn, I'm here to absorb everything. And this is also a potential job interview because a lot of hospitals who accept students are also looking to mold them, possibly train them if they like you, which is a big it's like dating, you know what I mean? It's like you have to like them, they have to like you. You obviously want to put your best foot forward, and I obviously want to review some stuff before I step foot in the ER. But this video starts today. Today's Saturday, March 15th. Tomorrow is my first day, and I thought I would do a little intro real quick to give a little bit of a background. I graduate in a month and a half, so in 6 weeks. Hi guys, it's much later now. I just got back from work. It's currently 10:30, 11 o'clock right now. I'm so tired and I have to wake up at like 4:50 a.m. I have to leave here no later than 5:15. I packed a lunch, I packed some snacks, I packed all the forms that I need to take with me tomorrow for my preceptor to sign. My uniform is ready, my scrubs are ready. At this point, all I need to do now is enjoy an ice cream, which these are the Yasso bars. These are like the Greek yogurt ice cream. I honestly really enjoy these. They were on sale for like 15 of them for like $7.99 at Costco, and I was like, yeah. And they're only 80 calories per bar. But I'm gonna enjoy this, and then I'm gonna brush my teeth, and then I'm gonna go to bed, and then I'll see you guys very soon because we have an early call time. Just woken up. It is 5:19 and I'm about to eat some protein oats before I head out. I might be late because I just realized that I don't have a Celsius here and I feel like I need some energy for the day, so I might have to stop and get a coffee. First world problems. Ideally, I would like to be at the hospital by 6:15 because we have to take a shuttle. Also, I made my own granola yesterday. Does this look like something you'd buy in the store? I'm ready to go. I'm also exhausted. I only got like 4 or 5 hours of sleep last night. But we're not gonna talk about it because today's gonna be a good day and I'm gonna get a job offer. Just kidding, I don't know. Hopefully. I just wanna go, and honestly, it's sad. I'm really excited for this rotation, but I am just so tired to the point where I just want this first day to be done with. But I'm excited and grateful. So today I work 7 to 7. It's funny because my old work schedule for Lululemon used to be on Sundays 3 to 8, so I can't do that anymore. Now I'm just talking to talk, but let's go to clinical. I just got here, guys, and I'm kind of nervous, honestly. I don't know why I'm nervous, but I stopped to get my coffee, and I'm not even gonna get to finish it because I'm gonna go in right now. I just want to be early, and I have to poop. Hi guys, I'm done now with my first day. Honestly, I really need to sit down and debrief because this has been a really cool day. And honestly, this is kind of like my calling. I don't know. I like to say the least, I had 2 codes today, and one of them we had like a literal time of death, and the nurse felt like a pulse every 15 seconds. So the doctor was like, this isn't sustainable for life, but she made it. What? Anyways, I got to do so many IVs today. I got to do so much stuff that I've done before. I put in a Foley for the code blue patient. I am just like so happy with today, and hopefully the vibes are staying like this, but I want to do a whole debrief when I get home. So I'm gonna drive home, and I'll see you guys when I get home. You can't see me, but it's day 2 at the ER, so let's head in. Done for the day, guys. And the nurses gave me some cake. Yay. Guys, I am so sweaty. I'm done for the day. I had such a good day. I saw someone get intubated, and I really like the nurses on this unit. They even gave me some cake, as I showed you guys when I was walking out, and another nurse saved me pizza. That is so sweet. She saved me pizza when she asked me to get an EKG for her. So I went and got it for her, and then she comes back and she's like, I saved you some pizza with your name on it. I had such a good day. And I want to talk about my story from Sunday shift. It's Thursday today, so we'll talk about it all when I get home. Hi guys, it's a few days later now, and I've officially completed my first 2 days in the emergency room for my immersion/preceptorship. This whole video I've been saying I wanted to talk about my first day in the emergency room because I saw 1 cardiac arrest and I saw 1 man who came in from losing consciousness. I just recently learned code protocol, and it varies from hospital to hospital, but I just recently learned the protocol. It was very cool to witness it on my first day. Basically, this patient came in, had a witnessed cardiac arrest, and the son had called 911 and they had responded to the call. They brought them to the hospital and they were working the patient. Now what I mean by working the patient is CPR, pushing life-saving drugs like epinephrine and things like that to open the blood vessels so that blood can flow properly. So they brought the patient to the hospital and the code team is activated and they have this Lucas machine on, and I'll put a picture of the Lucas on the screen so you can see. It's basically a more effective and consistent way to deliver chest compressions. So they were in the room and it's very seamless. The paramedics just bring the patient in right through the glass doors and boom, like couple steps and the patient's already on the table. Everyone that was in the room was doctors, nurses, medics, pharmacists, just like everyone knew what they were doing. It was like a dance almost, like who's doing this, got it, and it was perfect. Because they do this so often and they practice it so much, it's cool to see how competent everyone was with their job. At this point, the patient had been down for 30 to 40 minutes. For those that know life-saving support, you can't shock asystole. You cannot shock asystole. Asystole is basically, in layman's terms, flatlining, meaning there's no electrical activity in your heart. This patient did not have that when we were monitoring her. It's not humane to keep working a patient when they are not having a shockable rhythm, it's not sustainable with life. It's not sustainable quality of life. You can't live that way. So at that point, the physician had declared a time of death, and we had a moment of silence, and one of the nurses was touching the wrist of the patient because we were assessing for pulses, things like that. There's a whole protocol and like procedure to follow. So that would explain why the nurse was touching the patient at that moment. But also, like, someone had just lost their life. We obviously want to pay respect and be of the utmost respectful. There was a pulse, and then there was a coinciding beat on the cardiac monitor. There was one beat every 15 seconds. Again, not sustainable with life. At that point, that's like 4 beats a minute, and we had already called the time of death. Now, that doesn't mean that you can't take back the time of death, because that's ultimately what we ended up doing. I'm on FaceTime with my sister who's crying. No, I'm not. Essentially, this patient came back to life. We took back the time of death. We took back our moment. Well, we still did a moment of silence. I don't know if you can take back a moment of silence, but we took it back. And we started working the patient. She needed to be excutaneously paced, meaning a pad here and a pad on your lower abdomen so that you can pace the heart. The physician thought it was escape beat. An escape beat is a form of a cardiac arrhythmia, in this case known as an ectopic beat. And we did an ultrasound of the heart, and her heart had swishing in there. So again, I don't know what that means, but that's what the physician said, and it's not sustainable life. Then we started pacing her. Then we pushed atropine. Atropine is a medication that will speed up severe bradycardia. Bradycardia is a slow heart rate, which in this case, she technically did have. Now, everything leading up to this point had supported that this patient was going to pass away. The asystole, lack of being able to obtain a blood pressure, she was very cold and being worked for very long and having 5 rounds of epinephrine in her already from the paramedics and from us. So this patient just did not have it in for her. Odds were not in her favor. She did go to the cath lab, and then she went to ICU after. But I just wanted to share that. And I know that some people won't believe me, and it's just one of those things that you had to be there to witness it or to see it like actually happen, because that does not happen every day. So that's my story on that. So that was my first day in the ER. And if you're wondering if I'm scarred by it, I'm not. Honestly, I thought I would be, but I'm not. It was very cool to witness, and I'm glad that patient made it, because I know that's not the case for most people. Before I end this video, I do want to answer a question that I had from a subscriber. Oh, first of all, thank you so much for your comment. Any engagement that I get is so meaningful, because I am a new YouTuber, and I just appreciate every like, every subscriber, every comment. It just means a lot to me, and I love doing YouTube. I don't really post anywhere else. I'm not like trying to be a TikTok or anything. I just love doing YouTube, because I grew up on YouTube. I've watched it my whole life, and I love editing. I think it's so fun. I thought I would just try it now because I am in my last semester of nursing school, and this is something that I do want to look back on. And I do want to answer this question. How do you balance work and school? Have you worked the entire time you've been in school? I have not worked the entire time that I've been in school. I've started working at Lululemon, which is my current job now, in October of 2023, so my junior year fall semester. And honestly, I balance work and school by not overloading myself with work on the weeks that I have important things to do, such as exams, lectures, or Zoom calls that I know I need to be on there. With that being said, I will not work as much that week. That's how I've balanced it since junior year, and that's what I've continued to do as I'm nearing graduation. I'm fortunate enough to work a job where I can pick up shifts and drop shifts as I need to. I am genuinely scheduled 2 to 3 days a week, and I'm very fortunate enough to have a job that allows me to swap shifts, pick up or drop shifts when needed to. So I honestly don't know if I could have done work and school if I didn't have a job like Lululemon. I definitely would not recommend working if it's avoidable during your first or second semester in school. Once again, I know it's not avoidable for everyone. Taking that time to adapt to how you study and learning time management will really help in the long run. And then maybe once you have your feet on the ground, you can start adding in more extracurriculars, or you can maybe pick up more shifts at work. But I would say the best thing to do is maybe find a job that is flexible, or let your current job know that you are starting school, your school hours, your commitments, and where you can give and take. At the end of the day, you do what's best for you. This is just what worked for me, and I'm not trying to tell anyone how to do anything. With that being said, that's the end of this video. Thank you so much for watching. I do want to film more days/weeks in my life in the emergency room. I'm really enjoying it. I've done so many skills so far. I've done so many IVs, EKGs on my own, and I'm learning about more medications every single day. Thank you so much for watching, and I will see you guys in my next video. Bye.